Hi everyone, welcome to part 6 of my journey from heart failure to heart transplant. In this video, which will be the last of the series, I will talk about everything that happened on the day I had my heart transplant surgery. From being told there's an offer of a heart available for you, to getting prepped for surgery, having the surgery, and the days that followed. So 16th of June, I was officially moved up to the urgent or active transplant list. And I was shifted to ICU because my kidneys and liver were failing. At this point, the pain was just agonizing. The way I describe it is it felt like I was being crushed. The pain wasn't just localized to my chest, it was everywhere. I was taking such short breaths in and out because it just hurt so much to breathe. The beds in ICU were awful. They didn't help at all with the pain. I called them the monster beds because basically the bed mattress itself moves, so it kind of felt like there was a monster inside. The reason these beds move is because a lot of patients in ICU have limited mobility and can't physically move their bodies to get blood flowing. So these beds are essentially designed to keep blood flowing in ICU patients to prevent things like blood clots. But I just hated these beds so much. I even asked the ICU nurse, please can we switch the bed off because it's making my pain worse? And she goes, I'm so sorry, we can't stop the bed from moving, but we can give you something stronger for your pain. I had already reached my maximum painkiller dose for that day, but she said she could request something stronger from the doctor. I thought about it first, and then I said, I think I'll be alright. The reason for that was because even though I was in a lot of pain, I didn't want them to give me opioids or something that would have loads of side effects because I knew my body was struggling as it was and I felt very sick. There was just this fear inside of me that if I had something stronger and my body didn't like it, I would just vomit it out and I would feel worse. So I thought, I can deal with the pain. The doctors wanted to start me on dialysis for my kidneys the very next day, on the 17th of June. Obviously, I had no idea. The ICU staff had no idea that in less than 24 hours, instead of being started on dialysis, I was going to receive an offer of a heart and was going to be prepped for the biggest surgery in my entire life. Around 6 o'clock in the morning, I received a call, but because this was my first night in ICU and I was essentially surrounded by patients left, right and centre, I thought it would be a good idea to switch my phone to silent, just in case some rando decides to spam call me in the middle of the night and disturb myself and everyone else. So I was asleep when my phone rang. So, lesson learnt, as soon as you are put on the urgent, active transplant waiting list, keep your phone on, volume up and off silent. We all make mistakes in life. Anyway, 30 minutes later, a lady in navy blue wakes me up and sort of startles me. I think it's because I had my earplugs in, and for a moment when I woke up, I just forgot where I was. And then I remembered, oh yeah, I was transferred to ICU. I'm not in the wards. This lady, who happened to be a transplant coordinator, she was the one to break the news to me. Sorry for startling you. Are you Marine? I've just come to let you know that we may have an offer of a heart available for you. Oh. Now I know it must be quite a big shock, but we'll be here soon to give you more details and explain the process. Do you have anyone with you? Yeah, I've got my parents. Do you want us to call them to let them know the news, or would you like to let them know yourself? No, I'll call them myself. Now, it's very important that you understand that it's still very early and we can't say anything is guaranteed. But again, we'll come in a bit and explain everything. After the transplant coordinator left, I was still very shocked. Rightly so. I mean, I had just woken up first of all, and then to be told that there's an offer of a heart for you after less than 24 hours on the urgent list. I wasn't going to get my hopes up because I had seen a lot of patients in the ward and they'd been waiting for ages, and I knew that there was a chance that I could get a false call. So I kept thinking to myself, anything can happen and things can change. The ICU nurse who was looking after me, she was so happy, and she kind of asked me if I'd be alright to call my parents, and I said, yeah, it's just a big shock, but I will let them know right now.
Right now.
1 hour later.
I was informed of an offer at 6:30 and I told my parents at 7:30. So for a whole hour, I kept that information to myself. One of the biggest reasons that I didn't tell them instantly was because I knew they would be sleeping. And I also knew that if I told them, they would drop everything and rush to the hospital to be by my side. And I didn't want that. I really didn't want that because I really wanted to spend that time just alone in my thoughts. I was praying in bed. I was reflecting on everything that just happened, trying to mentally process what just happened, and just expressing as much gratitude to God as I could. When I did call my family at 7:30, I had no idea how to break the news to them because I didn't want to be boring and just say like, I might have a heart transplant today. No, this was going to be a big moment, so I wanted to break the news in a fun, light-hearted way. My dad was quite worried because I never call them so early. The first thing I said, because I knew that they were obviously very worried and concerned, was, everything's fine, I just need to tell you all something. And then I said, yeah, there's a heart. And then we all started to cry. A lot. The end. By 8:30, my dad was by my bedside, so that if anyone does come and give information, he would be there to also take in that information. An hour later, my transplant coordinator came to see me and told me and my dad the plan. I would be nil by mouth and have all the prep done for surgery. The retrieval teams would go to inspect the heart at the donor hospital, and if they were still happy, only then would I be taken to theatre to have my transplant. I remember saying to my transplant coordinator something like, so my donor, are they... I couldn't bring myself to say the word dead, but I think my coordinator realised this and said it for me. Yes, the donor is declared brainstem dead, so they are deceased. I think as a recipient it's so important to really understand there was nothing else possible for the donor, because ultimately you are going to be receiving an organ from them. I then started to cry and I said something like, it's just so difficult. Someone is gone. My transplant coordinator was just amazing. He was so amazing. I remember he said something really beautiful. He said, I know it's a really difficult thing to process, but you've got to understand that despite one person sadly dying, they could potentially save up to this many people's lives and give them a new beginning. So that was the first time that I really, really properly thought about my donor and my donor family. Before my transplant, I would never even have considered organ donation or thought about it or spoke about it, because it's just not something we talk about. And here I am actually receiving an organ. I think that was the turning point for me. I really wanted to dedicate my life to talking about organ donation, because at the end of the day, that family had that conversation. Despite being in such immense grief, they still thought about someone like me, someone else. Half an hour later, I met with the surgeon who was going to do my transplant. He spoke to me about the risks, but I distinctively remember when he told me about the risk of being put on ECMO, which is essentially life support. He looked at me in the eye and he really tried to get me to understand that ECMO is not a joke. It is a very serious complication and that I should be mindful about it. 10 hours later, I went into theatre. Yeah, 10 hours later. During that time, the ICU nurses gave me a bath. So they took off all my ECG stickers and gave me a bath. When I say gave me a bath, I don't mean like proper, dunk me into a bathtub. No, as in like they literally just have like a bowl with antibacterial solution, and then they just have loads of wipes and then just dipping the wipes and like scrubbing me all around. That's what I mean when I say bath. I could just say clean, to be honest. They also shaved me a bit down there. This was to make sure that the area around the groin was clean and accessible, just in case something happens during the surgery. For example, one of my cannulas stopped working and they need to administer IV medication very, very quickly. Apparently the groin has a really good vein and you can do it, and yeah. I already had entry points in my neck and arm. They did the neck cannula the night before because they anticipated that I would need emergency dialysis. So I was already prepped in that sense, which was great. They may have done some kind of chest x-ray on the bedside, but I just don't remember. I don't really have much memory of that day, apart from people coming in and out and doing things and my parents coming and going and coming and going. Yeah. I often think back to the moment I'm getting wheeled to theatre, and I honestly think, how on earth was I so calm? They're about to take my weak, dying heart out and replace it with a very, very, very strong one. And I'm just on the bed. I genuinely remember this. I'm just on the bed and they're wheeling me and I'm just like, I feel so calm and at peace, and I just feel so angelic and like, whoosh. I don't know how to explain it. I think the biggest factor really just comes down to my faith. As a Muslim, this was the ultimate test of faith. In Islam, it's called having tawakkul, which basically means you leave everything to God and you trust in His plan fully, not partially, fully. So whatever the outcome, you will be content. You will be grateful, even if the outcome is not in your favor. If I live, alhamdulillah. If I have complications, alhamdulillah. If I die, alhamdulillah. Ultimately, I had no idea what was going to happen during that transplant surgery, and neither did the transplant team. Nobody had any idea what could happen in the next 4 hours. So I left everything to God, and that's why I went in smiling and completely at peace. After getting wheeled into theatre, the transplant team, one of the ladies, she confirmed my name and said it wrong. And my transplant coordinator, he was the one like wheeling my bed to the theatre room. He said, "Oh, don't worry, it took me ages to learn it." Stuff like this just made me feel so relaxed and really distracted me from the whole operation, heart being taken out and changed thingamajig. When they got the bed into the room, oh my god, it was so funny because the bed was so like big. They couldn't get it into the room. Eventually they did, but they had to like open an extra section of the door because the bed wasn't able to fit in. Anyway, when I got into the room, they had to move me from the bed to the theatre table. So they used that funky slidey thing that they just sort of whoosh underneath you, and then they all grab a corner and they'll be like 3, 2, 1, and they all lift. And I was, yeah, basically. Then they did their final checks, which literally took like 2 minutes, and yeah, they were ready to put me to sleep. So I'm on the theatre table, and I remember looking back and I saw that my surgeon had entered the room, all in blue, all properly scrubbed up. He came behind me and said, "Maureen, everything looks good. Are you ready?" And I said, "Yeah." I mean, not like that, but like very confidently. And he was like, "Good, that's what we like to hear. So we will go ahead and put you to sleep now." A lady was checking the cannula in my arm still worked, and I could see that she had the white liquid ready. The white liquid is basically propofol. It's a general anaesthetic, and you'll know it because it's white. It looks like milk, but it's not milk. It's a general anaesthetic that's going to make you fall asleep. Then a man, who I presume to be the anaesthetist, came behind me, and again, really lovely person. He said, "Right, Maureen, I'm gonna put this mask over you. Just breathe normally for now, and in a moment, I'm gonna ask you to take 3 deep breaths in." This was just an oxygen mask, and I remember when it went over, I was like, oh my god, I can breathe. I don't remember anything after my second deep breath. I don't even know if I did it or not, because by then, I was gone. The next thing I remember is waking up in recovery. So back in ICU, I could literally hear and see my donor's heart beating in my chest. It was such a surreal and emotional moment. I'm never, ever gonna forget it in my life. I hope I've been able to give a little glimpse into the transplant process, and if you are on this journey, please feel free to reach out. There are lots of support groups, and I have linked a few in the description box below. And finally, if you are considering being an organ donor, then I truly hope that my story reaffirms that decision, because I would not be here without the kindness of a stranger and their family saying yes to organ donation. So yeah, thank you again, and we did it!